let's discuss about one of the common conditions around the elbow, which is called tennis elbow, commonly called as lateral epicondylitis in medical terms. What is tennis elbow? Tennis elbow is tendinosis and inflammation at the origin of extensor carpi radialis brevis tendon. So who is affected? Of course, people who play tennis. Why? Because this is the mechanism which is prone for this condition is repeated pronation and supination movement while elbow in extension. For example, if you imagine a tennis player performing a backhand is more prone for this kind of condition. It's recorded that up to 50% of the tennis players at some point in their life could develop this condition, and also some people who do sort of repeated flexion extension of the wrist movement can also develop this condition as well. So what are the pathological findings in tennis elbow? So why does it occur? So a repeated pronation and supination movement with elbow and extension can cause microtrauma to the extensor carpi radialis brevis tendon here. So this microtrauma can initiate vascular reaction. And if you look into the histological features, if you take a piece of tissue from the tennis elbow area and if you look into the microscope, we can see angiofibroblastic proliferation and also disorganized collagen deposition in the histological features. Let's look into the clinical features of tennis elbow. This condition commonly affects people between age 30 to 50 years of age. If you look into the clinical features when they come to the clinic, they often report dull aching pain on the lateral aspect of the elbow. Often these symptoms are increased with repeated wrist extension movements, and sometimes they report weakness in the grip, and also sometimes they may report pain on gripping some objects as well. And if you clinically examine the patient, if you look at the elbow, it may appear completely absolutely normal, but when you start palpating, you may encounter tenderness at the origin of ECRB tendon, which is a few millimeters distal to the tip of the lateral epicondyle. So, and if you compare the grip between the affected and the unaffected side, there may be reduced grip strength as well. So, and there are certain movements which can provoke this pain at the origin of ECRB. For example, with the wrist in extension, resisted wrist extension can provoke this pain. Once again, with elbow in extension, resisted finger extension can provoke this pain, and also with elbow in extension, extreme palmar flexion of the wrist also can incite pain because it pulls on the ECRB muscle belly. So how to diagnose this condition? Is there any investigations which we can do? Generally, X-rays are normal. If you look into the AP lateral radiograph of elbow, and in some cases MRI may show inflammation at the origin of ECRB tendon. The diagnosis is purely based on the clinical evaluation only, just based on the history and clinical examination finding. So how to treat tennis elbow? If you look into the natural progression of the disease, in majority of the cases, the symptoms will resolve spontaneously if you give time between 6 to 12 months. But if you have to treat, non-operative treatment is the mainstay treatment. In more than 95% of the cases, people do respond for conservative measures. The conservative measures are rest, anti-inflammatory medication, activity modification, physiotherapy for stretching of the tendon, and ultrasound guided steroid. So what is activity modification means? So identifying the activity which can provoke this pain and avoiding that particular activity. For example, if somebody is playing tennis, certain alteration, for example, using a large grip strength and also using a racket which is flexible and reducing the tension in the string might substantially reduce the symptom severity. Once these conservative measures have failed, operative treatments do have a role, and they are successful in 85% of the cases. Operative treatment involves release and debridement of the ECRB origin. So the operative treatment can be done either open or arthroscopic technique. With either of the technique, there is possibility of complication, for example, lateral ulnar collateral ligament injury, and also iatrogenic radial nerve injury. So if you have to conclude, in summary, tennis elbow is inflammation and tendinosis at the origin of extensor carpi radialis brevis muscle origin. Pathological findings include angiofibroblastic proliferation and disorganized collagen deposition. Clinically, patients report dull aching pain on the lateral aspect of the elbow, which can be provoked by certain maneuvers with extension and resisted with extension of the elbow and resisted extension of the wrist. Radiographs are not necessary. Diagnosis is done mainly on the clinical features. Non-operative treatment such as rest, activity modification, NSAIDs, physiotherapy, ultrasound guided injections are mainstay treatment. Operative treatment involves release and debridement of the ECRB origin. This concludes tennis elbow.